Hi there, and welcome to Mercy Care's overview of general mental health and substance use services. In this video, we'll go over some of the services and supports that affect our members and their family members. At Mercy Care, we have an Office of Individual and Family Affairs. Sometimes you'll hear this office referred to as OIFA. What is OIFA? OIFA is a department that is made up of employees with lived experience as either a member, family member, or a combination of both. The mission of OIFA is to make sure that member and family member voice is present in our system and it affects change for system improvement. Our goal is to foster a culture of respect through offering support. Our goals are to help individuals and families engage with their health plan, access resources, and understand what services and supports are available to themselves and their loved ones. By helping individuals and families navigate the system, we build a community of individuals that are better equipped to advocate for their loved ones and share their story and experiences with others. Here's support services, a brief overview. Just like the OIFA department, there are individuals that work in our system that have lived experience of receiving services who now work in the community as peer support specialists sharing their experience. Peer support specialists assist in the recovery journey for members. Oftentimes, we are given advice from individuals that haven't experienced what we are going through. By having someone who had a similar experience in their own lives, sharing what worked for them and offering hope in difficult times, it's a lot more meaningful, and it also comes from the right place. Similar to peer support services, there are also family support services available to family members of individuals who receive services. Family support is really important because oftentimes family members do not know what to do when they find out a loved one is struggling with a mental illness. Family support helps families to understand mental illness, learn what to do in a crisis, and help their family members to understand how mental illness can affect their relationship with their loved one. Peer and family support originate from the disability rights movement of the 1960s. In the past, many individuals with mental health challenges were institutionalized, and when the institutions began to shut down due to poor conditions, the individuals that were in the community did not have a lot of support outside of their family and friends. Through banding together and forming their own groups, they learned that lived experience can contribute to the system in a positive way and help to improve outcomes. These individuals fought to have a seat at the table and started the movement of nothing about us without us. This meant that moving forward, there needed to be an opportunity for individuals who receive services and their families to have a say in the decisions that would be made regarding services. Additionally, we began to see peer and family-run organizations start to form, which are organizations that are run by individuals with lived experience that provide services to members and family members. In our network, we have several peer and family-run organizations. These organizations have shown through research and data to be more effective in helping an individual to achieve recovery and develop a sense of belonging within the community. These organizations are also nationally recognized from the Substance Abuse and Mental Health Services Administration as an evidence-based practice. You can connect with peer and family support services by working with the Peer and Family Referral Center, or sometimes referred to as the PFRC. This agency helps to connect you and your family to services that are individualized and focused on your goals for recovery and community connection. The PFRC assists with the referral process and is staffed by individuals with lived experience. You can connect with the PFRC by emailing support@referralhelp.org or contacting 602-842-3308. In addition to services, there are opportunities to connect with the community to raise awareness about mental health and to fight stigma. You can join a committee. Committees at Mercy Care help us to make decisions and discuss system challenges. We have several committees with members and family members. Some of them are listed on the screen, such as the Governance Committee, the Youth Leadership Council, the Member Advocacy Committee, all text member councils in Phoenix and Tucson, the Cultural Competency Committee, and the Foster Adoptive Kinship Care Group. It's easy to sign up. If you'd like to be a part of the committee, you can visit mercycareaz.org/involve/committees to apply. Another way to stay connected is through joining the Access OIFA mailing list. Each Friday, a newsletter comes out with information on events in the community, job openings for peer and family support, policies that are open for public comment, and additional information that is pertinent to the community, as well as members and families. You can join the mailing list by texting OIFA list to 22828, subscribe at bit.ly/OIFA news, or you can capture a picture of the blue QR code on your screen to sign up. The way you do that is you take your phone and you open up the camera and you scroll over the blue square, and a link to the website of where you sign up should appear. Another way that you can stay connected is through our community-based partners, and one of them is NAMI, or the National Alliance for Mental Illness, and the local chapter is called NAMI Valley of the Sun. NAMI is the nation's largest grassroots mental health care organization. All of their programming is completely free, and there are groups that are led by family members and peers. In addition, NAMI advocates for policies that support recovery and person-centered care. You can connect with NAMI through visiting their website at namivalleyofthesun.org. Mercy Care also has an ombudsman within our OIFA team. An ombudsman is a neutral advocate that works with a member to provide system navigation and education, answer questions about services, help make connections for services, explain what options are available, and lets you know your rights. An ombudsman investigates member concerns and assists in finding resolution. Anyone can reach out to the ombudsman with a concern. We do request that individuals reach out to their provider as their first point of contact when concerns arise, but if you feel like you need additional support, the ombudsman is available to help. Even if the ombudsman is not the person you need to talk to, she will connect you with the right person. If you need to work with the ombudsman, you can reach out to her via oifateam@mercycareaz.org. Mercy Care also has some additional resources for members and families. If you have any questions, please contact Mercy Care Member Services at 602-586-1841 or toll free at 1-800-564-5465. This line is available 24 hours a day, 7 days a week. You can also visit our website at mercycareaz.org, or you can reach out to the OIFA team or the ombudsman by contacting OIFA team@mercycareaz.org. Thank you.